use a strategy map to answer NCLEX priority question. What do you mean by that? What do you mean by a strategy map, Professor? I'm going to show you. I'm going to show you what a strategy map is. I have one of my own, and I'm going to be sharing it with you today. And although this strategy map that I'm going to be teaching you tonight is not going to be for all priority questions, it's going to be for about 20% of the priority questions you're going to see in your exam. So I ask you a question. Do you ever feel lost when it comes to answering priority questions? Do you often narrow the answers in between two possible answers, but always or almost always end up selecting the wrong answer? Does that sound like you? Do you make that mistake? You eliminate two answers and you are left with two possible answers, and always you pick the wrong one. I'm going to help you today fix that problem. How are we going to do it? We're going to follow, or you're going to follow, this strategy map that I am going to be teaching it to you today. This strategy map is going to make a big, big difference. How to use a strategy map, okay? You can create your own map, that's okay. You can think of putting things together, but if I am sharing this one with you, just use it. All you have to do, take a photo or write it down in your notes, and you're going to be using this strategy anytime you see a prioritization question where there is a mixture of answers that are assessment and implementation, okay? So using a strategy map is going to give you a step-by-step process to analyze each answer and select the correct answer. So for example, let's say you're analyzing a priority question and you see that some answers are assessment and some answers are implementation. For example, take the blood pressure, monitor oxygen saturation, or giving a medication, teaching the patient or the family. That's the difference between an assessment and an implementation. So basically, you're going to see that in a prioritization question where you have assessment answers and implementation answers, you can ask this question. The scenario that I am facing, has the nurse conducted an assessment in that scenario? If the answer is yes, on the map, you put yes. So you ask the question, has an assessment been conducted? Has it been completed? Yes or no? Go to the map and put assessment, yes, or assessment, no. The next question is this an emergency? Is this scenario that you're facing an emergency? If the answer is yes, put yes on the map. If the answer is no, put no on the map. Now, you're going to have different scenarios. One scenario could be no assessment completed, no emergency. What's the answer? Assessment. That's going to be your answer. If you're facing a scenario where no assessment has been completed and it's not an emergency, your answer is assessment. You could have another scenario. Maybe there is some of an assessment, maybe a very subjective assessment, but no emergency either. Your answer is going to be another assessment. But in those scenarios where you're dealing with an emergency, as you can see in the map, if you're dealing with an emergency and you're clicking under the emergency column, yes, this is an emergency, most of the time, your answer is going to be an implementation. You go through the process of elimination and select the correct answer. It's that simple. Now, Let's practice it, because I know when you see it just on the map, it's difficult to understand. Let's actually see it on a practice question. Okay, so I'm going to show you the practice question. Now let's use it here on this question here. Which nursing intervention is priority for the client who reports experiencing acute pain? Let's stop right there. Don't do anything else. I want to ask you a question. Let's follow the strategy map. Number one, when you read the question, which nursing intervention is priority for the client who reports experiencing acute pain? I ask you a question. Has the nurse conducted an assessment? Do you see any information on the stem of the question that indicates the nurse did an assessment? No. So what do you do on the map? You put no on the first column, on the first row. Let's ask the second question. Just with this information, experiencing acute pain, does that indicate an emergency? So no assessment has been done. The patient is reporting experiencing acute pain, but that's it. It doesn't say where. It doesn't say the level of pain. It doesn't say the severity of the pain. It's just acute pain, sufficient information to determine that this is an emergency? No. So look at the map. If you're dealing with a scenario where no assessment has been done and it is not an emergency, what's my answer according to the map? My answer is going to be an assessment. That's my answer. Now, let's see what answers are assessment. And we can eliminate the answers that are not assessment. So number one is very easy. It says, assess the client's verbal and nonverbal behavior. That's an assessment. So we keep it. Number two, wait for the client to request pain medication. That's an implementation. Gone, eliminated. Because I'm looking for an assessment answer. Number three, administer the pain medication on a scheduled basis. That is an implementation. I'm looking for an assessment answer. Gone. Number four, teach the client to use only imagery every hour for the pain. That's an implementation answer. Gone. Through the process of elimination, the correct answer is one. Assess the client's verbal and nonverbal behavior. Now, does it make sense? Of course, yes. Because assessing the client's verbal behavior includes asking questions. Where is the pain? What is the level of pain? 1 to 10. Assessing nonverbal behavior describes also levels of pain. So this assessment is key to determine what's going to be my next action. So the correct answer is number one, because it's the only assessment answer that validates what the patient is reporting. 2, 3, 4, eliminated. Now, I see some of you commenting, Professor, but it says on the question, which nursing intervention is priority? Shouldn't I be looking for an implementation answer? No. This is a big, big mistake. Because in this scenario, the word intervention means an action. The action can be assessment or can be implementation. So it's very important to understand this. When you use a strategy map, if you follow the process step by step, you will get to the correct answer. Most of the time, you will not get distracted and confused. It takes time, it takes practice, but you can do it. We can do it together.